So this is Vinny Part 2. Hope you've had a chance to see Vinny Part 1 to understand how this discussion began. It's an email discussion, and I replied to Vinny's original email and pictures with this message, and I said I can't say with certainty what was causing the problem initially. Most likely now your artificial valves are causing a form of hemolytic anemia, although anemia isn't necessary. It may just be hemolysis, meaning the breaking down of red blood cells. As the red cells pass by the valves, meaning the artificial valves in the heart, they are broken apart. If I'm correct, a peripheral blood smear would show schistocytes, and schistocytes are also known as helmet cells. And basically what that means is a red blood cell is in general a spherical cell, but if it passes by a steel or metallic mechanical valve, it can be sheared and broken in half, spilling its contents, and it would assume a spherical shape before breaking open, and then leave half of a sphere, which would, if you imagine, might look something like an old helmet. And we call those schistocytes or helmet cells. The waxing and waning of this process can cause the purpura you're seeing on the skin. And then I finished that with best to you and Merry Christmas, hoping that that had answered his question. Well, that doesn't always work when I give somebody an answer. And Vinny replied, he says, is there anything that you can help me with this, or is there a cure for this? And to that I replied, I said to Vinny, the reason they're telling you there's nothing wrong is that there isn't. This is a side effect of the blood thinners and the mechanical valves. It's going to continue occurring for the rest of your life. Stop worrying about this and stay on your medications. And I'd hoped at that point that that would answer his question. He would understand that what he was looking at was indeed a side effect to the fact that he had 2 mechanical heart valves and was on warfarin, also known as Coumadin. And he replied to me, thank you for that, I really appreciate your help. And that's the last chance, or that was the last chance for me. So I know I'll stay on my medicine and stop wasting money for something that cannot be cured. By the way, thank you for suggestions. And so I hoped that meant he had gotten the idea that this was not something he needed to continue pursuing and seeing more physicians regarding, because this is very simply a side effect of the fact that he's got mechanical heart valves and is on a very potent blood thinner. And then I received this. One more question I think I should ask you as a doctor. Do you think that any particular time in my life, maybe after 2 to 3 years later, these valves would adapt to my body conditions in the way that natural valves work? Do you think that time this disease would go away? Telling me once again he still doesn't quite, Vinny's not quite getting the idea as to what's going on here. So I replied, I honestly do not think this will stop. You should expect to get these red spots continuously going forward, but they're not a problem. Just wear long sleeves. Obviously the red spots are bothering him, so I'm giving him a solution. And then I didn't hear from him for a day or so, and I replied to him as I began to think about his story and how interesting it was, and I sent Vinny this message. I said, your story is really interesting. I think others would enjoy hearing it. Would you mind if I share your story online with your identity protected? Of course. I would really appreciate it. Thanks, JG. And I did hear from Vinny again, obviously, or we wouldn't be talking about it, but he said, yeah, sure. Don't need to worry about my identity. It doesn't matter to me. If you like, you can tell my name to the world. You have my permission. You do not need to hide my identity. If you need anything else that might help you, please do tell me. I'm always ready to help to anybody. Who knows, in doing so, we can get something that might help me with my disease, the red spots. And so, once again, more evidence that Vinny's not convinced that I've given him an answer that he can accept regarding the rash or the intermittent purpura at the extremities. Then he further follows up with this. He said, if possible, can you discuss this case with someone else, like a dermatologist department? I think there should be some cure for it. As I know or read from the internet, I came to know that my blood my blood is thinner, so due to that, it starts coming out of my veins and makes smear red on skin. So what we can do is I can take medicine that can make my veins strong. One more thing, I also noticed that my body tries to heal these stops. Some get healed, but others just start coming again. Do you think it's possible way to take medicine and make veins strong? Please, if you have any friends or colleagues who know something about it, as we are told in life that if something happens in life, then there's a way to make it right. Please don't get me wrong. I'm just keen on getting rid of this disease. I think he's begun to understand now that the problem is he is on an anticoagulant due to having artificial heart valves. It's much more likely that he'll develop a clot that could go to the brain and cause a stroke. And so to help prevent that from happening, we use an anticoagulation pattern or program similar to treating someone with Coumadin. We have different anticoagulants now that are less likely to cause the kind of red spots that Coumadin causes or warfarin causes, although they're much, much more expensive. But at least this shows that he does have a bit more of an understanding, and he did send me some further photographs, and this would be one of the upper extremities here, and you can see some of these healing purpura or red spots. Here would be another one, larger one there, and several smaller ones at the left arm. I presume that was the left arm. Same situation here near the antecubital fossa. Not too bad though, if you ask me. I've seen a lot worse on patients taking Coumadin. Vinny's really upset about this. And then a healed one. So that's going to be the end of part 2, and I'm going to talk about what's really gone on or what's happened with Vinny, or at least to the best of my knowledge, just by having exchanged a few emails and looked at a few pictures with him. And that'll be part 3 coming up.
Hey folks, you've heard from hundreds of people who have benefited from Dr. Gilmore's Meta 7.
I love it so much. It gives me so much energy during the day.
I've noticed a change in my hair, my nails, my blood pressure.
There's no doubt that it's a benefit to me. It gives me more stamina.
And you've seen celebrities and fitness experts talk about Thynergy.
Thynergy. You guys are helping people lose weight.
This is a shout out to the team at Thynergy.
Thynergy. To all the crew at Thynergy, I wanted to just tell you guys to keep losing all the weight. You're doing amazing, and congrats on hitting your goals.
Now it's time to pick up the ultimate weight loss pack, Thynergy and Meta 7 together. Activate your life with more energy from Meta 7, then curb your appetite and burn those calories with Thynergy. Check out the Amazon links below and start losing weight today.